Dr. Travis Moore, welcome to ISF.
Thank you so much for having me.
It's great to have you. Why do you think we're seeing such a staffing shortage in the medical profession?
Yeah, it's a great question. There's lots of answers. I'll touch on a few. One is we just have more patients than we've had before. And this is for a couple reasons. One, we have an aging population, which is increasing demand for healthcare services. And then we also have a lot of people that are still trying to catch up on some of the things they may have put off during the pandemic era. The next is, speaking about the pandemic, it caused a significant amount of burnout with healthcare workers, which drove a lot of healthcare workers out of the industry completely. Fortunately, they're starting to re-enter, but we are still trying to catch up with some of those losses. And then finally, it's the educational pipeline. It hasn't been able to keep pace to meet the demand. And this is largely because of things like we just don't have enough faculty. We also have limited clinical training sites and limited funding to be able to expand some of these training programs. All of that together is dampening the amount of healthcare workers entering the field every year.
Still trying to catch up from COVID times seems like such an issue in the medical profession. Now, can you tell us about the survey and your company's initiative to support the healthcare sector?
Yeah, absolutely. So Indeed commissioned the Pulse of Healthcare report. And what we were really trying to do is understand where are healthcare job seekers and employers at. We've had all this information about healthcare workers leaving the industry or job hopping, and we really wanted to get a better understanding of what are the motivators behind that. One of the big bright spots in our survey is that we saw that the majority of healthcare workers, over 80%, plan to stay in healthcare careers, which this really shows the impact that they feel like they're making and kind of the calling into healthcare. That being said, 1 in 3 healthcare workers are experiencing at least one symptom of burnout. And so they are looking for better opportunities, things that allow them to have better work-life balance, as well as more schedule flexibility, and even simple things like better access to mental health resources. All of that collectively is why Indeed created the Careers in Care Hub. And so what we wanted to do is create a spot to house some of these different tools, resources, tips, tricks, and videos to help healthcare workers find better balance or maybe find their next job.
Thank you so much. And we really value our healthcare workers, and I hope that they come back from the burnout days, right? So for those who currently work in the field, or for those who currently work in the field or who are looking to start a career, what tips do you have to help them manage burnout?
Yeah, it's a great question. And I would say the first thing is acknowledging the fact that it's okay to feel burnt out. There are a lot of stigma around feelings of burnout. So know that it's okay, and you may experience that during your career. Communicate those feelings with your supervisor or your coworkers. In our survey, we found the power of relationships was huge in helping healthcare workers feel connected to their organization and have that work well-being. Simple things like setting boundaries. In healthcare, especially, there's a ton of opportunity. Many times you'll get like a shift bonus or incentive, and starting to think through, is that extra shift worth the impact that it might have on your mental health? And then typical things like prioritizing self-care. I know it sounds super cliche, but it's so important, especially in roles like healthcare providers, because we constantly go to work every single day to care for others. And if we're not filling our own cup, we don't have that to give back to our patients and then ultimately our families when we come home.
And prioritizing mental health is definitely imperative, especially in the medical professional field, right? So what should employers be doing to help?
Yeah, this is a great question too, and it's a lot of employers are starting to really double down and focus on this. And it's really simple things like establishing a good, positive, inclusive, supportive culture where it's okay to talk about things like burnout. We're measuring burnout, and we're actively providing resources to combat things like burnout in our facilities. As I mentioned earlier, our survey showed a strong correlation between job satisfaction and relationships at work. So those are coworkers, supervisors, and patients. So how can employers help facilitate better relationship building across their teams? And then finally, making sure that they're listening to their employees, whether this is through listening sessions, rounding, surveys, however you collect the information, and then taking that information and implementing new practices to show your teams that you're not only hearing them, but you're listening to them.
Thank you so much. And now for those of us, or even our ISF viewers, who are looking for a career in the medical field, or those who would like additional information, where can we go to learn more?
Yeah, you can check out the Careers in Care Hub on Indeed.com/careers in care. We got a ton of stuff on the website for you to choose from, explore different opportunities and the like.
Dr. Travis Moore, thank you so much for joining us on Inside South Florida and sharing all these medical professional careers that are available for us out there.
Absolutely. Thank you so much for having me.